lumbar that's not working out. Bring your knees forward a little bit. The knees should just be back at 90 degrees. That allows lumbar extension. If we don't get lumbar extension like this is not good. Whether you're doing a lumbar, thoracic, or shoulder. So we'd be okay doing the cervicals and the dorsals here. Technically speaking, doing the lumbars on this guy, this is a little lower than what should be compared to that. So let's talk about these cervicals. As I'm looking at his head and neck, it looks to me like we can put a little cervical extension in there for me. Like the face rest. Yeah, that looks a little bit better curved into the cervical spine. We don't want those bodies locked up in the front. When we have a sitting, we start that way, we'll try to contact and lift the chin up until let that spine start to drift. If we're doing atlas, we're going to expose the side of laterality. So I have ASR listings or AIR listings. There it is. This arm goes up above. I relax the trap line a little bit here. Chin is kind of neutral right there. Right there, nice and cool. Slide down off that mastoid process on the anterior lateral aspect of the atlas. Transfers from the superior hand contact. Slightly superior than the external arch to the sacrum. So come in like this. Here we go. Arch it up. Secondary hand like this. I'm standing slightly anterior to the segment, slightly superior to the segment. And ASR. Take the slack out. The throat's okay. And set it with the thrust with my triceps. Set like that. And hold it. With the S, tubercle is on A and then S. So as I do this, I torque. In this case, clockwise. I torque counterclockwise. And the torque occurs during the thrust. I, A. Right. So that takes care of lateral. Very nicely. We don't toggle. The recoil is set and roll. There it is. Set. Now this will work for you if you can't get into the sitting position. Here or on the island in the same position with the arm and the hand and turn the head. It'll work for someone who doesn't have a lot of lateral flexion. Put them on the island, they have to turn their torso a little bit and they can't rotate their head well either. Some of these older patients are like real nice for you. And they're already stabilized, so once that when you set up and make the correction, make the thrust, we set and hold, it goes pretty easy. We've got a couple of people in their 70s. Guy in his 50s that it works best to do it on the knee chest. And I go in there all the time if I adjust the atlas. And you don't get the same audible cavitation, you get the vibratory audible cavitation. You feel it set. I've had atlases set on this knee chest where I heard as much noise as I was sitting. The majority of them, I feel the movement when I set it. So I'm not banging away until I hear something. I'm feeling it. Vibratory connection and feel the movement of that nerve. So that's your left atlas. If we have knee rotation, I'd be directly over top, and A, I might be back a little bit. In all cases, I'm something S to I with articulation. In all cases, I thrust straight into the segment and torque according to the tubercle position. Thrust, torque, and hold. Just for a second. That's your atlas. The pads on the side now, that's nice. Shoulders are big down like that. That little curve in the neck. That little pressure there's your throat clear on the opening. Good. Alright, I always want to ask that. Knees just back to 90. We've got a nice contour there. Even adjusting here, I want this relaxed down here. One kinetic chain, and what goes on here affects here and vice versa. C2, we've got a nice big spinous. Come in there with either a knife edge, this, secondary hand, slack out, it's good, set, that, there's a wedge, set, and torque that wedge down. Either way, and torque it down, PRS. Quick to verify, inferior hand, if I had an isoform, I don't think it would fit well in him because my palm is contacting the occiput more than my isoform is contacting the ass. Doesn't fit in there very well. Some patients in light. Here's how it will look. Line of drive, we got lots of IAS with this guy, so it's going primarily through my inferior hand. The slack out, set, either way, just like that. That's your axis. I can do that down to C7, it's a large spinous down there. With my knife edge on that C7, I want to either strap the head down to hold it, or have some assistant hold it down. So when I go to set that, see what that head is doing, lob up on me. If I thrust there, push like that, it's all absorbed by the head extending like this. So I need to hold that down nice and steady. Now if I use an inferior hand on that guy, I can do this, go like this, hold it down, make the set, feet away, right west to this plane line, torque, goes the wedge, and set, just like that. Set. That'd be the large spinous. C7, C6, spinous like that. As we get into the smaller spinuses, knife edge sometimes is too big, a lot of times it's too big. We get in there with our thumb. I've got a PR on that fourth circle. I'll get in there on that segment. With my second thumb like this. Here I am. Feet away, eye to rest. Got a little lateral to me with my approach like this. Take the slack out. Here we go. We've got stabilization in the front so I can get full extension pushed into that before I make the thrust. We don't waste the thrust. We'll take that. Take it down. That's good. Set and hold. It's a very quick thrust. We've got to get all that slack out before we make that thrust. If I want to start up here, the circle's going to push all through that and end up gagging at the very end. Got to ease into it, take all that slack out. This is too big. With there on this child with my pinky. That, thumb on top of that, just like that. That's six. So I'm small on the spinous, pinky finger, this is your thumb. Maybe the spinous is too tender. Ouch. There's not a lot of right joint rotation in most of these circles, at least the more ones. The axis, yeah, you can log the spinous there. But most of these other ones, you could come in there on the lamina on each side. So if the spinous is sticking out here, I'm just going on each side of that spinous with my thumbs. There I am, taking the slack out. Here we go. Feet away, eye to rest to this plane on set. It's a nice adjustment for this. And a couple minutes we'll do the upper dorsals now. T1, 2, and 3. Keep doing these prone stabilizations again. You can use the inferior hand as your contact hand. Slide in on this T1, it's the PR. IAS, the lateral to medial tissue pull, then flat-handed as much as I can. Create my hands around the patient's neck. Coming in with my secondary hand. Stabilizing the head, pull the pressure down, the slack out, throat's good. Relax, we set it, feet away. I've got the lateral to medial with my elbow to wrist. I'm going to regulate the display line according to what the patient's disc looks like. It might be here a little bit, take it in. It might be here a little bit, depends on the patient. And then torque the nose and wedge if we have that. Just like that. Set and hold. There's T1, PRS. T3 can do the same thing. Down here. Slack out and clone. The slack out's the key, stabilizing is the key. If I don't stabilize here, I'm going to get the slack out, looks good, pull. This can bob up on me and absorb everything. This doesn't do it too bad, but that's why you're losing it, not getting it. You've got to tile with the knee chest. Transverse, I can stand on the opposite side. Get a right HT on this T2. There's the 2, just a little bit lateral and superior. Come in along kind of a knife edge form. Stand over the patient, so I'm feet away, get through the display line, stabilize the head, and set and torque it down, close the edge. If I've got somebody who's got a pretty pronounced primary curve, and that's upper dorsal approaching down like this, rather than trying to slide off that thing here, maybe put a superior hand on some of those guys, maybe fit it like that, and Mrs. Jones doing downwards or something. Just like that will do it. They come right in that plane line. Stabilize the hand the same way. gives me a much better fit through that display line in that case. So you see in the chapters that you're using your hand on those top ones, it's going to be dictated by what that spine part is. Right? All right, it's noon. Let's get lunch. We're back here at 1 o'clock.